Hello, hello. Good morning, good evening, good afternoon to everyone. Myself, Homeopath Viraj Shah, and on behalf of Vithoulkas Homeopathic Community Channel, I am welcoming you all in our live session with Dr. Dimple Kirpalani from Australia. She will be talking with us regarding homeopathy and the classical homeopathy in Australia specifically. Dr. Dimple Kirpalani is a practicing classical homeopath with more than 23 years of experience. She graduated with Bachelor of Homeopathic Medicine and Surgery from University of Pune in India in 1999. She is currently practicing classical homeopathy in Perth, western part of Australia. She is a registered member of Australian Register of Homeopaths and the New Zealand Homeopathic Society and the Faculty of Homeopathy. She has continued her education endeavors and has been affiliated with International Academy of Classical Homeopathy. In her quest for more knowledge, she has been associated with Professor George Vithoulkas since 2016, and currently she is e-learning coordinator in Australia for the course of Professor Vithoulkas. We welcome you, Dr. Dimple.
Thank you, Viraj. Thank you so much. That was a very generous introduction. Thank you to everyone who is giving us some of your precious time to come attend this live session. I'm very grateful to all of you, and thank you, Viraj, for the fabulous opportunity.
To start with the interview, but first I would like to ask you that what do you think about the title we have for this interview? The choice we make, why classical homeopathy?
I have a very strong belief system, Viraj. If you do something, you do it right, otherwise, you don't do it. And if we don't follow the principles, then anything that we do is not going to give us the results that it's meant to do. So if we say why classical homeopathy, if you want to do homeopathy, you need to do it with the way Hahnemann taught it. He was the master. He gave us a way. We have a very strong living master in Professor Vithoulkas who's actually showing what classical homeopathy can do. We have a fabulous community thanks to IACH. So I really don't think we have much to question on this topic. It has to be classical homeopathy. At least other systems, any other way of practicing homeopathy, I don't know which person I would give that much respect to that I would give Hahnemann or Professor Vithoulkas. experience talks.
Yeah. Tell us about your experience, because you have a very long experience, as I said, since 20, I think 23 years, and still you are getting so many, what we can say, charms from the practice. Tell us about the overall experience.
I have been very, very lucky, Viraj. I'm not going to deny that. I consider myself extremely fortunate. I am one of those people who can put a hand on the heart and say, I chose homeopathy. And I'm one of the strong believers. There's a quote that goes, choice, not chance, makes destiny. And I chose homeopathy. There's a very beautiful story that goes beyond that. And I actually chose it because when I was a very young child, I suffered from severe debilitating asthma for many years. Till one day, my mom took me to a classical homeopath for a consult. And this man, he was a freedom fighter for India.
Mm.
And he prescribed one dose of the remedy, and that changed my life forever. I mean, it not only changed my physical health and it gave me so much hope physically, but it also changed my course in life forever. Because it is it was the awareness of that there is a very brilliant therapeutic modality that exists like homeopathy. And Hahnemann has left us a beautiful legacy, and I really understood the need to study at that moment, the understanding that I can do more than just being a doctor. I can be a healer. And for me, that is not something that everybody has. We are very lucky to have that blessing that we can actually restore smiles. I mean, who can say they can do that? And if we can do that, I think that's a very big thing. So, yes, for me, homeopathy has been my choice. I chose homeopathy, and then I had all these wonderful, beautiful teachers who came and only cemented that fact in my life. You were meant to be a homeopath, and that's what you're going to do. So yes, I chose homeopathy because of that. And 23 years down the road, I have absolutely no regrets. I love what I do. And I absolutely, absolutely, anybody who knows me knows Dimple's a homeopath first and foremost. So yes, I'm enjoying it every single day and never look back. Never ever
Yes.
look back.
Right. Professor always tells us that the idea of practicing medicine is to make people happy, and
Yes.
this is what exactly you have said. But tell us, like the experience you have shared by of choosing homeopathy. In 23 years, you must have encountered so many times a kind of job satisfaction
Yes.
being a homeopath.
Yes.
Can you please share some of your great happy moments where people makes you smile?
Yes. See, Viraj, I'm one of those extremely lucky people who got to work in three different continents of the world. I studied in India. I started my work experience in India, but I got married to West Africa, to Ghana. So for 11 years in Ghana, I had to actually establish homeopathy because when I got married and I left for Ghana, there was no clue of what homeopathy is there. And so I had to register as a medical practitioner. I had to sit exams. I had to become an integrated physician. So I had to practice allopathy and I had to practice homeopathy on the side. And for 11 years, I saw some absolutely brilliant results with homeopathy. And I had no community there, no fraternity, nobody to ask any questions, nothing. I was only depending on classical homeopathy. That was the knowledge I had from school, from university, and that was what I was using. So for 11 years, I saw results I saw results in a community that literally opened its heart to me and said, we'll accept homeopathy. By the time 11 years came up, I was ready to move to Australia. I moved to Australia because of my children and their education. And by that was the time when homeopathy started coming from Great Britain. Some homeopaths had come in and they were starting to establish homeopathy in Ghana. And now, of course, Ghana has homeopaths everywhere. But at that time, I remember I had given my first lecture on chronic diseases and acute diseases in the college that was starting there. And it was such a joy to see the local people, the African people, the Ghanaians sitting and enjoying that lecture. And I remember using the science of homeopathy at that time to teach them that lecture. And did I know where I was going to land up? I didn't know, but I remember the smiles. I have never forgotten that warmth that came from those people who really wanted to learn what homeopathy was. So yes, that was my beginning. And in those years, I had some fabulous cases, stuff that you don't see anywhere except in Africa. Africa is unique in its, in its heritage. And yeah, there were some really fabulous cases and cases which I had to convince them that please use homeopathy, because I don't think allopathy is going to do more than what it is already doing. And it was such an amazing result to see them change, to see them smile, to see them happy that they chose the path that they chose. Yeah, and I had to leave them all behind and move here, which was extremely painful. And I still see patients from there online. It's a joy to see that people still continued for 13 years now since I left Ghana. And then I moved to Perth. And as they say, destiny takes you where it's meant to take you. When I came here, again, it was choice. This time it was a mother's choice. And I decided to stay home and practice homeopathy rather than run into hospitals and clinics. And I wanted to be there for my children. So then I started practicing in Perth. And I can't tell you how many years. It's been fun. It's been absolute fun in Perth. It's been really good.
Okay. But can you please tell us that we see that in Australia, the alternative health science is not very much popular. So what inspires you to continue practice homeopathy in an area where it is not well known, like we are having in India and some Asian countries?
Yeah. See, I don't agree with the fact that Australia does not have a place for natural therapies. It's a myth. It's an absolute myth. In the years that I have practiced here, I have seen some ardent fans of natural medicine, people who have known homeopathy for years. And the numbers are only rising. We know numbers are rising all over the world where people are moving towards natural therapies, moving towards homeopathy. So I don't think that Australia is any different. And we are seeing that happen. When I moved here, people told me, why do you want to practice homeopathy? You will not make any money. That moment, like I said, choice was being a mom first and looking after my children because they were very young. But it's been 13 years since, and honestly, it's been growing. My practice has been growing, and I think I can put a hand on my heart and say the growth has been positive. The numbers are just climbing. And I think a lot of homeopaths in this country would tell you exactly that. So, yeah, no, it's not that you can't practice. It's not that it's not popular. It's just very quiet. We don't advertise things in Australia. That's the difference. That's the only difference.
But what people say about all the alternative health sciences in Australia?
Or the ones who want to be, the ones who believe in alternative natural health are absolutely staunch followers of natural therapies. They don't even take a paracetamol if they can. They're very strictly, you have to convince them that, sometimes you need help from the other side. But no, they are very strict believers of natural sciences, and there's a whole heap of them. There are actually schools which
Mm,
are popular because these are schools where all the parents are natural therapy followers. So
mm,
it is what is shown in the media is one side of the coin. The media does not show you the other side of the coin because that does not create a controversy. The controversy is on this side of the coin, so that's what we are seeing. So
okay.
unfortunately, this is not the truth. It is very popular, and if it was not popular, we would be starving. Well, we are not. We are also here. So yeah, I don't agree with that at all. But it is what we are seeing in the media, which is false, always false.
Okay. That is quite amazing things, because actually we see what people wanted to
One-
see us. But yeah, that is yes, again it's a two side story. Maybe we don't know the other side, but
No,
like you say, it is very popular among those who are using it, and they
yes,
don't even use paracetamols and everything. That is really a good thing.
yes.
But tell us, in journey of homeopathy, you can, maybe you have come across so many homeopaths, well-known homeopaths, well-known schools, but how did you come across the teachings of professor and the International Academy of Classical Homeopathy, and what did you find at that moment of time that you want to pursue this study?
Okay. Viraj, I studied in that year of my year of years in the university. I had the best, the most renowned homeopaths in the world today were my professors. Okay. I had the good fortune of actually learning with what we call the masters, the so-called masters of homeopathy. Um, it was the year 2015 here in Australia when I actually realized that I'm very confused. So I had been practicing for 4 years, and I had come to Australia, and suddenly there was all these different forms of practicing homeopathy, all these different methods being used, new remedies being used, things being said. And when you've stayed in isolation for 11 years, when you get exposed to know anything, you question yourself, you start self-doubting yourself. And when I turned around, so many of these senior teachers and professors who I had respected all my life were teaching things which were completely new to me, which were methods that I had never heard of, which was it really breaks your confidence and just shatters your self-belief. It just makes you wonder whether you've been doing the right thing for so long. So then I decided, okay, now since you don't know anything, you may as well go back to studies. So I started Googling. Thanks to Google, I found the International Academy of Classical Homeopathy. And I immediately was like, oh, this is Professor Vithoulkas. I have read the science of homeopathy. I have used it. I was in year 3 or 4 of university when my organon professor, Professor Mahajan, had actually brought this book to the classroom and said, you guys call yourself doctors. And if you haven't read this book, you can't be doctors. So, it was that thing that got me to read that book. And I went, he's there, he's still living, he's still practicing, he's still teaching. I have to study with him. So I immediately signed up for Levels of Health, the postgraduate course online. I finished that, loved it, got the Levels of Health book in, started doing the strategies of prescription, finished that, decided to do the organon of medicine with professor, the course, started that, and then we got an opportunity to come to Elonosis. So we all,
uh,
6 of us, we from Perth, we got together and we traveled to Greece. And we went to Elonosis to do a course. And that was the most amazing experience ever. And it was a game changer for me. So basically, that was a reinforcement that classical homeopathy was the way to go. That I was mistaken if I thought there was another way to learn. I had to just strengthen my knowledge. So I started the e-learning while I was in the learner source. And yeah, I'm very grateful for that opportunity. Never looked back. I'm still studying, and I'm still repeating some of those courses again. But the
Yes.
joy of it is every time you do them, you learn something new. I've done levels
Yeah.
of health what, 4 times, 5 times, and it's still something that you digest, something new to digest every single time, something new that sticks in your head, something new that ignites a memory. So yeah, I very grateful to ISCH and very grateful to Professor, because honestly, how lucky are we to be living in a century where we have a teacher like him? I mean, really good. Very happy
That
with
is,
that. So that
that
was
is
my
true.
journey to ISCH. And now I'm the
That is
course coordinator, which I was shocked when I was asked to be the course coordinator because, like I said, at that particular time in my life, I didn't think I was good enough. So, it changed my entire way of thinking in life.
That is true. These two books have changed so many lives: the science of homeopathy and levels of health.
Yes.
And I always say to all my friends and colleagues that please read these books. And I also urge to all the authorities through this medium that please make these two book as a textbook or complementary books to the organon of medicine, and see how the homeopathic fraternity changes the way it is now.
Yes.
They will
Viraj,
definitely, yeah.
you asked me about people here interested, right? I have given out copies of levels of health to these interested people. People who have nothing to do with homeopathy, only
Mm,
interested in natural health. I've given out copies of levels of health to them because I see the interest.
mm, that is
It's
true.
like game changers.
I agree with you totally. But please tell us how the way, because you have practicing since very long, then you came across with e-learning course, and you have completely changed your way of practicing and your way of thinking, and maybe you have changed your practice upside down. I don't know, but please tell us how e-learning course affects in general, or your set of skill and your way of practice.
Okay. I was practicing classical homeopathy for a long time. So when it came to the basic skills, I knew I had them. But what I didn't have was how to put that skill into practice, right?
Hmm.
And that is where the e-learning course comes in beautifully. At the end of the course, you realize how good it has trained you in practice. Because you can have a lot of knowledge, but how do you put that knowledge into use is where most people find it difficult. And many homeopaths find that difficult. It's admitting that, yes, I do find it difficult. That is the most important step to be taken. So I think that was the biggest things to happen with for homeopathy with me. Um, in that fabulous learning journey that I've had with Professor Vithoulkas, I can definitely say that every single patient who now comes to me, I see that as a challenge. I see that as a test of my abilities, a test of my knowledge skills. And this was never the case. I was questioning that ability. That has completely disappeared. I'm ready to accept every case with joy, with the fact that I know what I'm supposed to do here. So I can tell you for a fact three things. One, awareness that homeopathy is extremely powerful and that it can make a huge difference. But good or bad, that is in the hands of the practitioner.
Hmm. That is
Always.
true.
The second thing I learned was prognosis. I mean, we have the levels of health, the best prognostics tools. That is so important because every single individual is different. Every single individual's facing the same disease is different. So if we are looking at true individualization, prognosis is very important. Without it, we can't really practice. And
That
then
is true.
the whole clarity in practice,
Mm.
because you would think homeopathy is so confusing and you think it's so difficult. It's not. If you do it the right way, you tick the boxes, you follow the steps, you use the right rules. Homeopathy is not that difficult. It is perfect. It is
Yeah.
absolutely effective. The most effective tool you can use for a health issue, I think. So, yeah, that is something I'm very grateful for. I remember asking Maria, why do you want me to do the e learning course? Then she actually told me to do it. And she said, do it. And then you will know the difference. And she was right. She was very right.
Okay. Now the difficult question.
The-
What part of e-learning is your favorite?
oh, no difficult question there. Levels of health.
Okay.
That's not
Please tell
difficult
us.
at all. Hands up, levels of health. It was the best part to study. It was the fun part to study. And it was the whole, it's like a bulb going on in your head. Like, yes, that makes sense. Nothing beats levels of health. Really, nothing does. The lectures are fun, Professor with his fun things and his experiences. It's interesting, it's beautiful, but if you're looking at it from a knowledge point of view, who can teach you something like levels of health? No one can.
No one
No
can.
one can. It's mind-boggling how good it is. So yeah, no, hands down, levels of health. Those were the best lectures.
Yes, definitely. Because when you will hear levels of health, sometimes you also remember the case you have got
Yes,
failure. And then you realize your mistake. Ah, this was
I
the
had a load
mistake.
of those. I had a load of those when we went like, oh shit, what was I doing? What did I do? Why didn't I stick to the medicine? Why didn't I step back? That is why.
Yes.
That was
Yes,
so.
I totally agree. I totally agree that yes, again, levels of health is the great theory. I cannot imagine practice without referring levels of health.
Can't.
I cannot. Okay, specifically about the e-learning, I would like to ask you that how e-learning course is helping students in Australia, what they will get and how it will get benefited by doing the course.
See, Viraj, Australia is like any other country of the world, right? It has its share of problems. And I understand that. One of the biggest problems that we are facing in Australia currently is in the healthcare sector, because they depend a lot on the modern medicine and science and that this thing. So it's fine, it's up to them. But how do we change the outlook, or how do we change this atmosphere without actually causing a political drama, is by education. Giving the right education in homeopathy is by far the only singular method by which we can ensure a good generation of homeopaths in the future and a continuous following for homeopathy, and which we can offer through the 2-year e-learning course, right? It was one of the earliest courses to be recognized by the RO, which is the Australian Register of Homeopaths. And it has proved to be quite popular in my understanding. I can see so many students signing up for it. And I personally feel it's it's a course you can't go wrong with. It's very comprehensive. It covers
Mm,
every aspect of homeopathic practice. It
mm,
trains you so well that you possibly don't want to think the wrong way. If
mm,
it creates an atmosphere of fear in your heart, then remember, even a surgeon has to be scared when he holds a knife in his hand.
That is
You
true.
are dealing with a modality that deals with health. If
Mm.
you're dealing with a modality that deals with health, please be aware that fear is a natural factor and it should be there because you are responsible for someone's health, for someone's life's condition. So to be scared is good, but to know and to work in the right order is by far the best thing ever. So if you do the e-learning, be prepared that you're going to end up with superior knowledge, with a good idea of how to practice. And I will say this, I'm the course coordinator, I'm also the clinical supervisor, right?
Yes.
All the students who finish the e-learning course, they get the diploma, they get registered in the tier 2 with the Australian Register of Homeopaths, correct? This gives them an opportunity to practice legally in Australia. So they can start practicing as soon as they sit their exams and do their clinical training. And it also ensures that they become part of a fraternity. They can join the Australian Homeopathic Association and become part of the fraternity of homeopaths. It's always good to have people who believe in the same things as you do. So it is one of the things that I like about the e-learning, that we've managed to get it so far recognized.
Mm.
Also, the whole aspect of a course that has been completed by so many students now who've sat their exams and are doing their clinical training. I'm the one
Yes.
who's seen them fulfill the case requirements. And
Yes.
honestly, each one of them leaves me speechless. They are doing
Mm.
such an amazing job with their case taking and their prescriptions. It's it's an eye opener. You do things
Mm.
the right way, people can follow you. And Professor
Correct.
Vithoulkas has always done things the right way. It's without doubt that the students are following him. So I find it amazing. I find it extremely, makes me really happy when I see them see success the way they are seeing. Very
Mm.
successful case taking, very successful skills and prescription. You can't get that kind of stuff.
Mm. Can you please tell us more about AROH, the Australian Registry of Homeopathy, how it works, and what
Okay,
how
so
the course and AROH is getting connected? Just to have an idea to the future students who may have planned to move to Australia, or the current student of homeopathy.
the Australian Register of Homeopathy is one body we have, and the second body that we have is the Australian Homeopathic Association. Okay. The Australian Register of Homeopathy is what we call the legal body. So this is a register of homeopaths. So they
Hmm.
maintain the registry for all homeopaths who are qualified, and they give them a tier according to their level of qualification. So you can
Hmm.
register in tier 1, which is the lowest level. Then you have tier 2, which is the medium level. And then you have the tier 3, which is high levels of practice. Um,
Okay.
the Australian Register of Homeopaths is basically legally, once you're registered with them, you have legal proof that you are qualified enough to work as a homeopath in this country. It's your backing body. It's the body that actually gives you a backup, is
Hmm.
supporting you to do well in this country. And because you're part of the Australian Register of Homeopaths, you tend to meet more new people in the Australian Homeopathic Association. A lot of people in this country have an objection to being part of any association or paying fees, or why do we need to do this? But my question always is, if we don't unite, we can't go further. Unity is everything. If we are going to go and unite with other alternative sciences, then we are possibly putting homeopathy in that category. To have our own home is always better than living in a home that belongs to, which is rented. Let's put it that way. Would we rent a house, or would we want a house of our own? For me, RO and AHA represent a house of your own. So that is the way I see it. And those who register with RO find it that, every year you're reminded to do your into your insurances. You're reminded to do your first aid training. All those things are important. It is part of being legally a practitioner in this country. So yes, I do believe that that's important. We from the IACH made an effort to approach RO for recognition of the 2-year e-learning course. And when we did, we filled in forms, we clarified that we fulfill every requisite module that is required for the study of homeopathy in this country. Boxes were ticked. We made all the effort to make sure that there was nothing left unticked. So
Hmm.
basically, the 2-year e-learning course is completely fulfilling all the requisites by the government of Australia.
Okay.
Okay, so we are definitely providing a course that is comprehensive even in that aspect.
Hmm. Hmm. Okay. So anyone who wants to practice homeopathy in Australia, they can do this course and then they can register with AROH,
Yes,
right?
yes.
Then what will be the difference between AROH and AHA,
So
Australian Homeopathy?
AROH is your registration body. AHA, the
Okay.
Australian Homeopathic Association, is your fraternity body. So basically,
Okay.
that is an association where you find out which webinars are going to happen, which events are going to happen. You attend the national conferences. You have they have a newsletter every. They have a newsletter. They have a journal. So it's more the educational aspect, the friends aspect, the community aspect that Australian Homeopathic Association gives you, whereas RO actually just gives you your legal requisites.
Okay. Apart from all this successes with e-learning course and AROH and everything, I hear that homeopathy specifically from all alternative science they call it, but homeopathy is still a kind of modality which is having more critical things apart, in compared to the other alternative science. How do you see the future of homeopathy specifically in Australia?
Okay. Homeopathy survived for 200 plus years now, Viraj. Right? It has survived all odds. It has always been criticized. And it's a well known fact that currently it is the most followed alternative system of healthcare in the world. The
That is true.
WHO recognizes homeopathy. We all know that, right? And the current statistics by the Homeopathic Research Institute actually states that over 200 million people around the world use homeopathy for their routine healthcare,
Hmm.
right? So when we look at those numbers, how do we even think that a humongous country like Australia would not have followers of homeopathy, especially a
Hmm.
country which is full of migrants? Everybody in Australia generally is a migrant, and all those migrants are well aware of homeopathy. They come from countries where homeopathy is popular. Yeah, we may not have that fabulous status that homeopathy enjoys in, say, India or Pakistan or even Germany or Switzerland, but we are not too bad. It is the
Hmm.
fact that media likes to keep a lid on us. So again, it's up to the media to decide whether they want to do the right thing or the wrong thing, and we can never teach media anything. Critics are going to be everywhere. We are going to be hounded everywhere. But
Hmm.
fact is, the numbers are growing, and if we keep doing the right thing, nobody can keep us quiet. We, we have to. We have to get
Yes.
it right. So
Yes.
I don't think I don't think anybody needs to worry about what the status of homeopathy in Australia is going to be like. No matter what happens, people who want it are going to find us. I'd never advertise Viraj.
Hmm.
Okay. I have a website which I don't think I have looked at for God knows how many years. I don't advertise. I don't have a board outside my clinic. No, I don't. I don't have anything that says that there's a homeopath here. I still don't have appointments to give for months in advance. So that tells you that it is popular. It is my only source of income since I have moved here. Yes, my husband is earning money as well, but this is, if I have to say this, I can comfortably live my life with the money that I make. So I don't see it as not popular. It is very much around, and I think it will stay
Mm.
around. I don't think anybody can put homeopathy down.
What people used to say on all these critical things, because there is a voice where critics are saying that homeopathy is such, and the other voice which is not so heard in so many ways, which is the voice of people who actually have experienced the power of homeopathy. What they used to say regarding this critical aspect?
In 2016, till 2016, homeopathy was covered by private health insurances here, private
Hmm.
medical health insurances, right? After
Hmm.
2016, the government decided that homeopathy and other alternative therapies cannot be covered by private health insurance companies. At that
Oh.
moment in time, Viraj, I was very new in this country. And I really thought that this is going to affect my practice, that I'm going to lose out on patients, that, people will not come anymore because it's expensive, right? It never changed anything, Viraj. It
Hmm.
never did. In fact, the growth was continuous. People didn't care. People came, people brought people, people sent people. I have always had word of mouth being my biggest source of income. And
Hmm.
it happened. So, people try to put the good thing down, but intelligence and a sense of wanting something new always exists in humanity. So
Hmm.
people find their way. People look for answers. People knock on every door that they possibly can when they want
Hmm.
answers. And if
Hmm.
we can provide those answers, they are happy. And at the end of the day, that's what matters, the happiness of people. And homeopathy does make people happy,
That is
right?
true.
So I don't feel that we can, take the critics into full this thing and say, oh, what will happen tomorrow? No, I think we would just create a state of anxiety for ourselves. It's not fair to do that to ourselves. We are here for a purpose.
Hello.
Yeah, are you there?
Oh, yeah. Okay. Right. You have rightly said that the voice of people is totally different than what the voice of critics, because experience says a lot. I remember that Professor Vithoulkas has also written a paper on this critical suppression of homeopathy in Australia.
Mm-hmm.
What
Mm-hmm.
can you share your views on this paper? Because I'm also sharing this link in the chat box to all the viewers.
Yes. Yes. So this paper was written by Professor Vithoulkas in the year 2017. And it was right after that critical whiplash that we had faced in Australia as homeopaths. This paper was titled Serious Mistakes in the Meta Analysis of Homeopathic Research. So I'm going to say that again: serious mistakes in the meta analysis of homeopathic research. This was the paper. And all I can say is that this paper was written with absolute accuracy. And you can only respect that, because Professor Vithoulkas clearly pointed out 5 points in that. If I'm remembering it correct, there were 5 points in it. One was individualization, that homeopathy does not treat the disease but the person. And hence, the remedies need to be tailored to the individual only. And he said it
Mm.
very clearly there, because one of the critical things was homeopathic aggravation. And he said it in that paper that homeopathic aggravation is a positive effect of the remedy. It is not a harmful aspect, and it should be given due consideration.
Yes.
Absolutely right. And then he had also said that one remedy is not going to be needed in the treatment of a chronic case. You need multiple remedies, and that the prognosis of each chronic case depends on the individual. And so you can't say two people with the same disease are going to be treated in exactly the same way or will recover in exactly the same amount of time. And of course, then he said that um, when homeopathy is prescribed in the early onset of a chronic disease, that it's the time when it works best. We get the best results. Now,
True.
each one of these things is a basic foundation of homeopathy. You don't, whether you say you believe in classical homeopathy or you don't believe in classical homeopathy, the fact is these five things are
Will remain.
trademarks of homeopathy,
Mm.
right? So if these critics did not take these five aspects into consideration, that only clarifies to the people who, that these people who wrote this report had no idea about homeopathy. They had no knowledge about what they were talking. It was
Mm.
like they were cooking a meal and they did not know the taste of the ingredients they were putting in the meal, and they did not know the steps they had to take in cooking the meal, and yet they said they had a banquet and they had invited all the other critics to join them in this banquet. It's ridiculous, honestly
Mm.
ridiculous. You can't even understand how good this paper, this paper was literally a slap in their face. And if they don't see it as that, well, that is their problem. They don't want to accept it. But I think it was a very well written paper, and everybody who is interested in homeopathy, I'm not going to say only homeopaths, I'm going to say everybody and anybody who likes homeopathy, uses homeopathy, plans to study homeopathy, is studying homeopathy, or is practicing homeopathy, should read this paper, because you need to know where you stand. And
That
this
is
particular critical acclaim that happened in Australia has affected us all over the world. But the point is, intelligence says there's no way this was done the right way. So I rest my case. This paper was amazing.
okay. Apart from this, all these things, now we come to know, or we are at the end of this interview, and with all this experience since many years, specifically in Australia, I would like to know which are the things to be kept in mind if the students are studying there, specifically the homeopathy, or in general the e-learning course, or how do you think it will benefit the people of Australia if the good number of homeopaths will be there?
If you are planning to study homeopathy, that means you know what homeopathy can do. You are somebody who has used homeopathy in the past, right? So my first thing there is, once you know that this is what you want to do in life, then find the way to do it in the best possible manner, right?
Mm.
If you are doing the e-learning course, you've given yourself the best option for success. You've set yourself
Mm.
up for success without a doubt. Now comes the factor of putting in the hard work. Well, nothing in life comes easy. I don't think anything in life comes easy. So putting in the hard work is important. Not swaying from the right thing is very important. That
Mm.
shows your mettle, that shows your confidence, that shows your quality as a person.
Mm.
So I think it's very important to understand that it's not only that you are studying the right thing, it's also following the right thing and not giving up on it. That is the
Mm.
most important. So I think everybody needs to know this: homeopathy is very effective. It is effective in every single way, including financially effective. It is financially effective for you as a homeopath in Australia. It is financially effective for your patient as a patient of homeopathy in Australia, because it is definitely in the long run going to save you from a lot of expense if you're looking at homeopathy as a treatment for any long term illness. right? So given the current environment that we are seeing everywhere in the world, where financially everybody is feeling the stress, economically everybody is feeling the stress, where, from everywhere in the world, we just going, what's going on around us? It's not like we haven't seen the worst of the worst in the last, couple of years. So we do realize now that homeopathy has a very important role to play in society. And becoming a homeopath with the right education means you will actually contribute positively to a good society. So, my point is, if you can make a difference, you should make it. And if you want to study homeopathy, well, welcome to the fraternity. I would happily say, come and become a homeopath. It is important. Do good and be good. So, yeah, definitely it's going to make a difference.
Can you please share an experience with the student of e-learning, which give you, still it is giving you a great joy, that yes, I got it right, or homeopathy is like, this is the right way to do it?
There is not one student, Viraj. I can actually say there are so many of them. At the current point, also, I can say each one of those girls or each one of those people. There's a gentleman as well. He's going to hate me for saying only girls. Each one of them who's doing the clinical supervision. Their every success makes me smile. And I'm not talking only about clinical supervision. We've got a student. We all know about her. She has had published cases. Makes you feel so proud. Published
Yes.
cases is not a small thing. We have another person who's done the e-learning course who is orienting herself to research in homeopathy. She has also had published cases. We have another person who actually is helping out with the AHA and is always, is practicing at the same time. Some of these are women who are mothers who have young children. They are using homeopathy at home for years now. It's brilliant. You can't say one experience. It's the process. It's the whole thing that matters. Every little thing that matters. I'm so proud of some of them. Like they have their life hands full. Young babies, little babies. We don't have help. We don't have families to be with us. We are alone. And yet each one of them is successfully doing it. And it makes you so happy. When they pass their exams, the first SMS that I get, I passed my exams. Yeah, it's that whole thing. Can you sit for your exams now? I'm always, pushing them to sit for their exams. And every time I get that one, I passed my exams. You go like, yes, one more homeopath added to the group of homeopaths. And that's good. We have a generation in Australia that's coming. So yeah,
Yes.
I'm very happy about it. It's not one experience, Viraj. I can't pick one. I really cannot, genuinely cannot pick one.
Okay, so yes, it is the same experience I also have, because being an administrator of e-learning course, where they share the testimonials of e-learning course, sometimes you feel the words are not only the words, they
Yes.
are the emotions.
Yes.
They are the emotions. So, and we see how they have, the e-learning have changed the
Mindset.
way they see the world. This
Yeah.
is what I see from the testimonial, and we also have experience. But once you experience and you see that it is happening again and again and again and again with each and every student, then you have to believe that yes, it is not a common phenomena, it's something unique phenomena, I would say,
Yes.
not common.
We had that webinar. We had a continuous professional development webinar where Seema asked a question and every single person unanimously answered that question correctly. I mean, how does that happen in a class of homeopaths? That is really something. She pointed it out immediately. How is it even possible in a class full of homeopaths? Everybody said the same remedy. That is e-learning. That is e-learning. You can't go wrong. It's
Yes, yes, yes. Now you have said about the webinar. I would also like to share that the next webinar which we are going to have is in November. I'm sharing the website of webinar in the chat room. And this time we are coming with the webinar on dermatological diseases. So last time we had the mental diseases. Now we are coming with dermatological diseases, and particularly this webinar will be having on November 4th and 5th. So yes, I would say that the webinars and the students are also getting more and more learning through webinars. Okay, so thank you so much for sharing the experience specifically, because there were so many questions regarding homeopathy in Australia, homeopathy in Australia with e-learning course and AROH, and you have cleared out all the clouds. Now the sky is clear.
thank you,
and
Vijay. Thank you so much.
and I would say that student will get the good guidance if the teacher is great.
Yes.
So yes, we have professor with us, and being a mentor to the student, you are also guiding them in their education and the case supervision. I would again say thank you to you for giving us a time and having chat with us. I don't know what else to say. If you want to conclude it.
Really, I can't even believe that you are thanking me for this, because honestly, this is what I signed up for. And there is nothing here that I have said that is not coming from my heart. I can only be grateful for the education that I have been given. I can only be grateful for the opportunities that I have got. And it's with full gratitude and full humility that I say, not everybody is as blessed as I am. Always supporting me when I send you all the technical questions and go, Viraj, I can't handle this. You are always there. Come night, come day, I have messaged you and you've stepped up. So realistically, don't thank me. You're doing a far greater job than I am. So thank you very much, my friend. You've done a lot. And thank you very much for giving me this opportunity. I'm glad, and I hope I have answered questions. And I hope always that I'm a good mentor, because I don't think anybody can beat that.
Yeah. Okay, so the people around the world, let's have a break, and we will come again with more interviews and more people who will guide you to the right way of practicing classical homeopathy. Professor is always there. If you wish to hear and learn directly from professor, please join e-learning course. Please join e-learning course. It will really change your life. And please also see the webinars, because webinar is the place where professor is specifically solving your questions, because student can ask the question and professor is giving the answer. So I rest my case here with Dr. Dimple, and we will come again with another interview with another good homeopath in the future. Bye bye. All the best. Good night.
Good night,